I didn't think that it was possible, but Lyric hearing aids just got even better. Hi guys, Rachael Cook, Doctor of Audiology at Applied Hearing Solutions in Phoenix, Arizona. And in today's video, I'm going to be telling you how Lyric hearing aids just got even more convenient. Coming up. If you've ever done research into invisible hearing aids, then you probably already know about Lyric. Lyric hearing aids are the only extended wear hearing aid on the market. Instead of putting these in every morning and taking them out each evening, Lyric hearing aids reside deep in the outer ear canal, sitting just a few millimeters from your eardrum. The deep placement allows Lyric devices to leverage the anatomy of the outer ear and ear canal. This not only optimizes sound quality, but can also help you determine where different sounds are coming from. Not only can they provide excellent sound, but the medical grade foam combined with the insertion depth can allow for incredibly comfortable long-term use. Lyric devices remain in your ear canal for up to 2 to 3 months at a time, providing 24/7 sound in arguably the most invisible hearing aid on the market. And because of their full-time use, they also serve as a fantastic option for those who notice a reduction in their tinnitus when utilizing amplification. And the hands-off kind of set it and forget it aspect of these devices make them extremely convenient and reliable to use. Until recently, there were only really 2 major drawbacks that I could see to using these types of devices. Number one was the fact that they had to be removed and replaced in office by your hearing care provider every couple of months. And number two, in the event of an unexpected device failure, there were obviously going to be some periods of time where you weren't hearing your best until you could go in to get those devices replaced. But both of these drawbacks may have just been solved thanks to new FDA clearance. That's why today I'll be telling you how the newest update to Lyric guidelines is making them an even better and more convenient option than they even were before. But before we do that, if you could please take a quick moment to give this video a thumbs up, it really brings videos like these to a wider audience. And while you're at it, make sure to hit that subscribe button with notification bell so that you never miss any one of our newly released videos. Now, if this is the first time that you're hearing about Lyric hearing aids, make sure to check out this deep dive by Dr. Cliff Olson or the Q&A session that I did about Lyric, both of which will be linked in the description below. But if you're wondering if Lyric could be a good option for you, let's review some initial candidacy criteria. First, Lyric is intended to provide amplification for users with mild to moderately severe hearing loss. The ideal candidate will not have any outer or middle ear conditions, like frequent ear infections or a hole in the eardrum. Lyric users will also need to be free of conditions that can impact your ability to heal, such as bleeding disorders, autoimmune conditions, radiation to the head or neck, or extended steroid use. Certain lifestyle factors can also impact your candidacy, like swimming, skydiving, scuba diving, or the need for frequent MRIs. Assuming that you are a strong candidate, Lyric devices are available in 7 different sizes, ranging from extra, extra small all the way up to extra, extra large. These devices typically offer between 10 and 12 weeks of better hearing before they need to be replaced with brand new devices. For this reason, Lyric hearing aids are actually only available on a subscription basis. This means that instead of paying for new devices every single time, you simply renew an annual subscription. The only real drawback of these devices has been this idea that you have to return to your provider's office every 2 to 3 months for out with the old and in with the new. And while most patients are totally fine with that plan, this could be a bit of a hassle if you live a far distance away from your provider's office. And for some users, the need for professional replacement could also make it a bit more challenging to schedule vacations, participate in water-based activities, or receive regular MRI testing. But things are about to get even easier and more convenient for Lyric users thanks to Lyric self-replacement. Lyric self-replacement will now allow select users to replace their own devices every other time without having to return back to their provider's office. This can help cut return visits in half, making them an even more convenient option for those long distance patients or in those special circumstances. Not only that, it will actually allow providers to issue replacement devices in advance. This means that some users will actually be able to replace their devices as soon as they die, rather than having to wait for an office visit, which helps to minimize interruptions to hearing your best. Now, this option has been available in other countries for quite some time, and it has now been recently cleared by the FDA for select Lyric users in the United States. Now, I must say that not every Lyric patient is going to be a candidate for self-replacement. And the only way to know if you're going to be a good candidate for this option is to meet with your own certified Lyric provider. For example, patients with significant earwax production will still want to return to their provider's office to ensure their ear canals are clean and clear before replacement. Additionally, users with more challenging ear canal anatomy, those with limited dexterity or feeling in their hands, and those with cognition concerns or dementia will not be good candidates for this option either. And while you might be chomping at the bit to get started, just know that this isn't an option right away. In fact, you'll need to be using Lyric devices for 3 months before you can be considered a candidate. This is to ensure that your ear canals will respond well to Lyric devices overall, and so that you can get used to the fit, the feel, and the sound quality of the devices when they are properly inserted. If you wear the devices for 3 months without incident and you meet the other candidacy criteria, then you'll be eligible for a self-replacement orientation and training by your provider. During this training, you will learn proper insertion techniques, how to determine when the devices are and are not working, and how to troubleshoot physical fit or sound quality issues. You'll also need to demonstrate your ability to complete this independently before you're given your own replacement devices. So don't call your provider's office asking for a backup set just yet. And if you're wondering how this played out in the clinical study used to obtain FDA clearance, just check out this data. This Lyric self-replacement clinical study included 56 participants with an average age just over 63.5 years old who have used Lyric hearing aids for an average of 4 years. Of the 56 participants, all of them were able to successfully self-replace their devices after an orientation, with 93% of them being able to do it after only 1 training session. Safety data from 550 insertions showed no statistically significant difference in safety outcomes when placed by the user themselves as compared to a Lyric provider. Users were even able to place their devices within nearly 0.5 millimeter of the insertion depth reached by their hearing healthcare provider. They even maintained consistent scores on aided speech and noise testing, proving that self-replacement was not just safe, but just as effective for the right candidate. Now, I will say that this data does beg the question, will Lyric ever be an entirely self-fit hearing solution? You know, like where devices would be programmed and shipped to a patient without any sort of in-person appointments. However, knowing what I know about Lyric devices, especially when it comes to outer ear canal health and conditions that may arise, I feel like we're pretty far way off from that happening, but only time will tell. Overall, the FDA clearance for Lyric self-replacement every other time is an incredible advancement that will reduce office visits, increase independence, and minimize interruptions to hearing your best. To see if you qualify as a candidate for Lyric self-replacement, be sure to schedule a consultation with a certified Lyric hearing care provider, which you can locate at the website linked in the description below. And if you already use Lyric hearing aids and are interested in self-replacement, be sure to discuss this with your provider to see if you're a strong candidate and to schedule your self-replacement orientation.